Mabuhay! I am Qijel Mariano, a third-year student from the University of Santo Tomas College of Nursing. And I am also the Youth Council member of the United Nations Joint SDG Fund. Greeting you a happy International Youth Day, transforming food systems with the theme, Youth Innovation for Human and Planetary Health.
Hi, good evening. This is Lea Saldo from Baguio City. I'm a nurse, an OFW nurse, and I'm affiliated to King Abdulaziz Medical City. I've been working here for 20 years. This is my friend, Sally.
Hi. Hi, I'm Rosaline Martin, and I'm working as a staff nurse here in King Abdulaziz National Guard for 7 years.
And this is also Leah.
Hello, good evening. I'm Leah Alcaraz, working also as staff nurse 2 in medical oncology. I'm working here in National Guard for 2 years.
So what is it like to be a nursing student amidst the pandemic? So there are a lot of challenges that we face. Number one is trying to adapt to the new style of learning. We recall the stories of student nurse CJ and student nurse Ethan, who make use of like these dummy pillows where they put a lot of markers of the chest, where they perform auscultation and palpation techniques. We recall the stories of student nurse Stephen, who would use his own bed instead of those beds used in the hospitals on how to do proper bed making. And these are very different from what we actually know in the hospital setting. So the tendency is we don't know if what we're doing is right. Problems like these often dishearten nurses like us. But luckily for us, our teachers also know how to adapt accordingly. So there is a consistent ecosystem of innovation between all of us. And this is something we look forward to as we become the next batch of nurses and frontliners for our country.
Nurse. It is a challenging moment, not only for me, but for all the healthcare workers here. And at the same time, all healthcare workers were prioritized.
Like this is a challenge for us healthcare workers. Now it's like on the top, like health workers were the heroes as
Top of the list.
we are
of the
appreciated at this
healthcare
point
workers.
in time.
It's very significant during this crucial time because it's challenging. They will put you on the front line during this pandemic because we're the one taking care for the patients directly, not like the doctors. The doctors are just giving the orders, but you are the one taking care of them, being with
And
them
the pride
bedside.
of us being a nurse now is like really
Like you're being called to be in the front line. So just
Why do you want to be a nurse? A nurse is not just about becoming licensed to heal, but it's also realizing that this profession is an art, a science, and now more than ever, an action. We need to realize that every step we do as a student nurse right now is not to become a future doctor or to become a future registered nurse, as they say, but it's also to realize that we are qualified to create researches, policies, and new innovations to address the most pressing problems here in the Philippines. So I want to be a nurse because I want to know the important research models that I could use in the community setting. There are a lot of things that I have learned in nursing school that I get to apply in my job in Streets to Schools and also in the Joint SDG Fund. When we consult with different organizations, we bring with us every nursing theory out there to bring out the best health outcomes in each community. So is the nursing profession given enough recognition here in the Philippines? Why or why not? So the problem is a lot of nurses are still not recognized to the full extent of their capabilities. They are not properly compensated with the amount of work they are given. Nurses continue to be underpaid and overworked. And with the hazard pay during this COVID-19 pandemic being close to none, it's important that we realize that investing in nurses means investing in the healthcare of the Philippines. Now, they make this joke that the greatest export of the Philippines is nurses. And as much as we find that funny, we need to realize that this is a greater call to action, that we need to celebrate nurses as not just heroes, but to realize that they have a better and more sound way of integrating healthcare to the people.
For me, nurses are in the Philippines are taken for granted.
Underpaid.
Underpaid. They're not being valued.
Lack of opportunity, overwork but underpaid. They're not giving recognition. Yeah.
Because if in a healthcare profession, regardless what is your title is, we don't work as an individual. We work as a team to be able to give a complete care for
And the government, and the
Are
government
not
is not
being
really
well
taking the answer. I mean, it's not really answering like the problem of the healthcare profession. At this point in time, they have programs, but it's not enough. Yet like the nurses will still go abroad. They prefer still to go abroad than to work here because of that lack of recognition, underpaid,
How did you feel when the first COVID-19 patient was recorded here in the Philippines? So just like any other citizen, we were fearful because what was already announced in China as something that was troublesome, it was finally brought here in the Philippines. And I echo the sentiments of every healthcare worker out there that we should have closed down our borders and implemented stricter protocols to ensure that we stop the spread of the virus even during the early stages of the lockdown. Now, nurses have that added responsibility to tailor fit health information to the public. We need to realize that the right to information has to be celebrated. And if the public cannot understand what is being told, that is a clear violation of their right. Luckily for nurses being at the forefront of human dignity, we can remedy that by making sure that the public is able to understand in a level that is appropriate to them. What major change did you experience while studying amidst the pandemic? So, of course, there were new return demonstrations that had to be done online. There were new online quizzes. Everything was new and everyone was still trying to adapt. But our teachers were very caring and they were very understanding of the situation. Maybe it's because they were nurses themselves, so they realized how important it is to be empathetic and compassionate during these times. But more than the romantic side of that, they were very practical. They had practice dummies themselves, they demonstrated the skills themselves, and we appreciate the resourcefulness of the nurses during these trying times.
The setting itself of how to deal this case,
the social distancing,
everything
the
was
protocols.
new to us, and
Like admission, we need to have swab, like the graphic, the seater needs to have swab. And in the malls, you cannot go also inside or the premise of the hospital without immunization. So this is like the changes that we have.
this is the moment that the nurses are functioning
As a
multifunctioning from security,
Yeah,
really from
interviewing.
interviewing, everything. The nurses are the ones who's doing everything compared to other doctors.
What is the greatest lesson that you have learned during this pandemic? So it is also important to understand that while we romanticize so many amazing things that nurses were able to do, the first COVID-19 vaccine that was administered all over the world was done by a Filipina, and she was a graduate of our university. We realize that these stories are amazing, but these stories lose their purpose if we do not demand for compensation for our nurses. We should fuel these stories as examples where we demand accountability and transparency among governments. So there was this recent issue where the DOH was not able to handle the funds of the COVID-19 pandemic well. Imagine if we were able to allocate those properly. How many lives could have been saved? And we need to tell these stories again and again to keep the conversations out there, to demand better compensation and better working conditions for our nurses. We also need to remember that most trainings of specializations are available abroad, and nurses tend to stay there to have a family, to start their new lives. We need to realize that the change has to come here to the Philippines, and we need to make sure that nurses get the proper opportunities so that they don't need to look for greener pastures out there when we make it already available here.
Material things are nothing. Useless.
True. And family bonding is really important.
Family bonding.
And it's so sad we cannot go.
The importance of environment.
And health.
And health.
Health as well.
And saving. Because
Oh,
we
yeah.
don't know when one of your family is affected, like in the Philippines, you get to spend a lot of money when you are admitted in the family. We are OFWs, we are the one like they depend on us on the expenses mostly because they have their notion like if you are an OFW you can
You
send
have
more.
lots. Yeah, you can send more and you have lots of money, but they don't do that.
We are also struggling.
Oo, struggling here. So, for me, health is wealth. Yeah.
What do you think needs to be improved in the healthcare system of the Philippines? So number one, we have to improve our research. Now we look up to the works of Dr. Beverly Ho. She created a lot of fellowship programs for emerging healthcare leaders that could pave way to better healthcare coverage to everyone. And this is not just for nurses or doctors. Even journalists, even social workers were given the opportunity because we realized that a public health crisis is the public's problem. Therefore, everyone should be mobilized in the public. So, to be able to understand, to grasp that urgency, we need to mobilize the entire public to know that they have a part, they have a role to play in making sure that universal healthcare coverage is available for everyone. And as nurses, equipped with the heart and embodying excellence in everything we do, we need to realize that the public's concern is also our greatest concern. Nurses think of people first before profit, but we need to compensate them properly to make sure they do their jobs right. So, realizing better allocations to healthcare is the first step to realizing a better future where healthcare is accessible to all. Because what we learn in school is important in the real world. We need to realize that it's not just about getting the uno on our card grades, but applying every single lesson in real problems that we are facing right now. What makes you motivated to stay on your career despite the flaws in the healthcare system and the effects of the pandemic? So what really motivates me is the stories of hope that we were able to collect throughout this journey. We remember one story of a child who was forced into prostitution by her family at the age of 8. And when she got the human papilloma virus, she eventually got cervical cancer. Now, imagine how unfair that is. That she was already born into a family of poverty and having to be burdened with cancer for the rest of her life. And we don't want this to happen anymore to the public. We can't allow this to happen anymore. We need to realize that a poverty problem is also a health problem. The Sustainable Development Goals all complement each other because of its indivisible nature. Solving one goal is also solving the other 16 goals. So by creating more opportunities for good health and well-being, you actually also get to apply this to quality education, women empowerment and gender equality, and so much more.
I think everyone wants to go home and relax and enjoy life as it is, but during the pandemic, it's not a choice. It's like it's better to receive monthly salary than nothing. During this pandemic, this is not the right time to go home.
This is not the time yet. It makes me motivated in the passion to help or to care for the people. Because
Actually, we're not safe. We get tired as well. We get
tiring.
Irritated to some. But at the end of the day, we always still give our best to help the people, all the patients.
So far, what is the fondest memory of nursing school amidst the pandemic? So we've got a lot of bad moments. We have had our fair share of lowest lows. But the student nurses are actually very connected, even those from other schools. We get to talk about our hardships, our aspirations, our dreams, and then we realize that how much we are needed in this society right now. We want to graduate not just with incentives, not just passing the boards, but we actually want to graduate because we are aware of what we actually need right now. We're building ourselves every single moment at this time. So while it is difficult, I can't sugarcoat how difficult it is because you'll really know how difficult it is to simulate labors even though you don't have a patient, or simulating auscultation when you don't even hear the breathing patterns. But we continue to press on because there's a greater call to action out there, and it's the nurses who can actually answer it.
Meeting different people,
Yeah, multicultural.
different nationalities,
You gotta adjust to any
adjustment to
culture,
different cultures.
to the very conservative.
Yes.
What is your message to the frontliners? To every nursing student, to every nursing professor, and to every nursing frontliner, I want you to know that you are all important and we value your ability to make a change despite these trying times. I want to remind you people that sa bawat padayon, kailangan rin natin magpahuway. We need to take a break. We need to take a pause to learn, relearn, and unlearn things again and again so that we can revitalize how we make this profession not just the profession of caring, but the profession of innovation and creating the new policies that will demand accountability, not just in our country, but all over the world. Because nurses are global leaders. We need to realize that this is more than just a profession. It is a platform. We realize that we can make a difference only if we realize just how far can this profession bring us to, address the world's most pressing problems. And we can't wait to see how this will affect student nurses like us.
Nursing, we all know, is a noble profession that you should have
Like a
long
heart
patience,
like really a heart to care.
and care. If you don't have it, I think you will not last the nursing profession. Even if you're so intelligent but you don't have this patience and everything, you will not last. Nursing is more of a heart.
Yes.
Doctors are more of
The brain.
intelligence.
Yes, we're the heart.
Sometimes I'm thinking of like taking care of other patients as I'm taking care of my family. Because if I will not think that, or I will not condition my mind with that kind of stuff,
Yeah, we
like
will not
you will not
last this
be
long.
inspired. If you really have the heart in nursing, it will prosper within you. Because you can really feel if you do have the passion. If you really have the heart
Go
to
for it.
do,
Go for
pursue
it.
it. Because nursing also is one of the best.
Profession.
Yes, nursing is, for me, really is noble and one of the best professions for the aspiring nurses. So,